Chris, yeah, part of it is significantly more testing, and part of it, yes, is increasing community transmission. There are, I would say, some encouraging trends in the data, as scary as the top line number may look, that suggest we could actually now be bending the curve, which would be very, very good news. At the same time, while we're seeing some encouraging trend lines, there are also some concerning data points that also suggest, while we may be bending the curve, infections could now be spreading into older and more vulnerable populations.
I think we have to understand that the rate is where it is because people are out and about, and it could even get worse before it gets better. And I think we have to have that expectation.
Florida broke a single-day national record with 15,300 new cases of COVID-19 this weekend. But a jump in lab results contributed to that record-breaking top-line number that came out on Sunday. A key number to watch is the rate of positive tests for people who have never tested positive before. That gives you a better sense of the pace of community transmission. A sustained rising positivity rate of new cases indicates infections are accelerating. A sustained declining rate indicates we're making progress in mitigating the spread. Last Wednesday, the positivity rate of new cases rose to 18%. That's nearly 1 in 5 testing for COVID for the first time and testing positive. That would be the high water mark so far for Florida. The positivity had been in the 14% range the first week of July. But notice, since our peak of 18% last Wednesday, the rate has since been dropping down to 11.2% on Saturday. That's the same day the state had that national record-breaking 15,300 new cases. Monday's report, which is always a day behind, showed the positivity rate on Sunday tick back up a little to 11.4%. We don't yet know if that's just noise in the data or an indicator that the rate will continue to rise yet again. But so far, the declining positive test rates for new cases suggest we may be flattening the curve despite the rising numbers of confirmed new cases. However, at the same time, we're seeing a rise in the median age of people who are testing positive. This indicates coronavirus is now spreading from mostly young adults into some older and more vulnerable age groups, and that could explain the rising number of hospital admissions.
Every week, we're seeing escalation of the number of people who are presenting with COVID. We're seeing, different types of people now with COVID. First, we saw this big spike in young patients. Then we sort of saw what we knew would come after that a couple of weeks later, sicker, older folks.
And with that, the state of Florida was one of only 3 in the nation that had not been releasing COVID-specific data for hospitalizations, county by county and across the state. That has changed. The state, starting on Friday, began releasing much more information about COVID patients, in which hospitals are they being treated, and it gives us a better idea of where the trend lines are going and to what extent hospitals from county to county are facing strain. So, Chris, we're going to dive into those numbers coming up in the 5 o'clock hour.
Yeah, and as we had in the top of the newscast, Hillsborough County now specifically has its own dashboard that includes numbers of people hospitalized and ER visits, so it's a little more transparent as to what's going on there. Craig, what are public health officials predicting or expecting by the end of this week?
They don't know. They will say the preponderance of data is encouraging despite the high numbers of new cases, largely driven by increases in testing. If you look at the positivity rate, that indicates that we're flattening the curve. However, the caveat is, we're going to be 2 weeks from July 4th holiday weekend by the end of this week. Well, what did we see 2 weeks after the Memorial Day weekend? We saw a noticeable jump in cases as more people got out and began gathering together. So they're urging some caution and saying we need to look at where we are by the end of this week to see if we see a similar upward jog in cases, which we don't want to see and in positivity rates, but we could see based on what we saw at the end of May and heading into the first 2 weeks of June.
Yeah, and maybe, too, we'll see an impact, too, from these mask mandates that have been in effect across the board for a couple of weeks now. Maybe, too, that will affect what we see at the end of this week. Let's hope so. All right, Craig Patrick, live for us. Thank you, Craig.